past 50 years, I started in August 1967.
1972.
71, 72.
1966.
My dad was a dentist.
I had a summer job in a dental practice.
I was fortunate enough to meet a very recently graduated brand new dental hygienist who encouraged me to try the new program.
The dental hygiene program, when it was first started, which was very much like any dental hygiene program in Canada, is that they were primarily started to fulfill a need in the community health sector of dental care. That was where it was felt that dental hygiene was needed. From that, then it continued to grow and it expanded then into clinical practices and then has continued to grow into many other areas as well. But clinical practice is definitely the dominant setting for dental hygiene.
When I came in the mid-90s, there was dramatic changes, I think, that were already starting to happen within the dental hygiene profession. We were looking at harmonizing the scope of practice or the techniques that we taught. Also at that time, we faced a number of challenges. The Faculty of Dentistry was slated for closure, and that had serious implications on the dental hygiene program also. So it took the concerted effort of all faculty of dentistry, all faculty of dental hygiene to work together to convince the powers that be that that wasn't the right course of action and to find alternate solutions.
Margaret McLean was the founder of the dental hygiene program, and it was instituted in 1961. She was a great person. She was very helpful for me when I started into the dental hygiene area. She assisted me in any of the questions I had regarding dental hygiene and how to handle certain items and what to do with certain things. She stayed after hours with me on several occasions to help me out, and I really appreciated that.
Mrs. McLean was a very inspiring leader, very strong woman, just led by example, was ready to participate and help at any time. The university undoubtedly owes a great deal of credit and gratitude to Margaret McLean for the success and the development of and future of this program.
The capping ceremony basically signified moving into your senior year. You were fully treating patients clinically in your senior year, and it was a rite of passage in a sense.
Our caps provided a practical purpose because they separated the pulley in the handpiece from being tangled in your hair. When a dental hygiene student appeared in clinic with a cap, it notified the public that this student was on the way to graduation and had passed some very important clinical milestones.
The capping ceremony was always a very special time. It literally was a feather in our cap. One of my fellow students ended up on the bus going home having forgotten to take her cap off and just had her outside clothes on but had forgotten to take her cap off and wondering why everybody was staring at her. The quality of the education has evolved constantly through the program. When I was in it, it was already a very compressed program, and as more innovation and more research was done, the program had that much more of a scientific background base.
We tried to jam-pack everything into 2 years, which was a daunting task at the best of times. It made sense to move the diploma into the 3-year and then add the additional year on for the degree program.
We didn't have to have our 1 year of science as a pre-professional year, and I think that that has really pushed and helped the program grow, establish it to be the profession that it is now. The delivery of dental hygiene care was fairly simplistic. We didn't wear masks or gloves.
You pumped the chair up with your foot, and if the instructor was a lot taller or a lot shorter than you, the patient was going up and down constantly.
Not even having the kind of basic instruments that we do now.
Wipe the parts of the unit and chair in descending order of importance. With the alcohol sponge, swab first the prophylaxis angle and the handpiece.
Today, the education that the students are receiving is in some ways broader from the perspective of preparing them for many different types of practice settings. Clinical practice, community, sales with dental supply companies, it could be with research. Wherever their role may take them in dental hygiene, the education is more broad-based to help to prepare them for that.
In the beginning, the dental hygienist provided pretty much strictly clinical dental hygiene. In the public health arenas, it was more public information and data collecting. With the increased educational background that the students have, their choices of practice settings are unlimited.
When we look at the future of dental hygiene, the future is really to create articulation to graduate programs. Establishing a baccalaureate program is really the foundation. If we can move in the future to have all dental hygiene students acquire a baccalaureate degree, then we can get hundreds of students to go on into graduate education, and we need graduate education for our leaders, our researchers, to really address the huge oral health care challenges that there are in society.
The dental hygiene program going forward in the future has just such wonderful promise. With the move into the new building, that's going to be so exciting and spectacular. We've been hearing about potential move into a new building for a long time, and now it's finally happening.
It will allow us to simulate the private practices in a better way. It will improve our infection control. It will help our students understand collaborative treatment better with dental students and also other healthcare providers.
Pharmacists, with nurses, with medical students. This has been a wonderful building, and we love it, but it's also, we've also been cloistered. So we want to be more interactive with other professions, and that's our opportunity is when we get into the new facility.
people have to remember that essentially dental hygiene is a very young profession. Our program at the University of Alberta is just 50 years old. So you think, well, 50 years is not really that old. Where we are today, we have much to go forward to do.
We began as a very, very small program. We've grown, and I just think it's a wonderful occasion to say that we've been here 50 years and we're getting better and bigger.
50 years of dental hygiene symbolizes many things. Pride of the profession that's grown from a very simple beginning to graduating very stellar professional healthcare deliverers. And I think that that's amazing, and I'm excited to be part of that program.